Well, good evening. This is Dr. Ellithorpe, and we are at Tustin Longevity Center here every Tuesday night at 6 o'clock to 7 o'clock. And we are here to talk with the audience about their various questions they have on complementary, functional, integrative medicine and standard of care. We are physicians here and healthcare providers that give advice and management to many patients over many, many decades. So we precede all the YouTube and all the breakthroughs in the carbohydrate, carnivore, natural hormone replacement therapy, um, light therapies, infrared therapies. We have been doing this and talking about these things with our patients. At least I did a second doctorate in it in 1999 to 2001. And we have been going over these things for many, many decades. I am absolutely thrilled and pleased to see the growth and the number of physicians and even highly considered of great repute institutions like Harvard and Stanford and John Hopkins and these places doing studies and including now even courses in functional medicine, integrative medicine. It's about time to see lifestyle medicine finally get into the practice of standard care. So we're very happy about that. Now, today, when we meet on Tuesdays from 6 to 7, this is not meant to be individual advice. This is educational. These are my opinions over my many decades of experience on these wide breadth of issues. If I don't know something, I'll let you know. I don't know everything, but I certainly, as a general practitioner, have seen tremendous, tremendous variety of issues improve of all disease types over the many decades that we've done this. The way to get a hold of us is tlcdoctors.com, and you can type into me some of your questions. There's limited number of characters so that you don't give me some long history, and just get to the point about you want to know what my thoughts are, this or that. And then the other way is on the live chat here. You can type in your question, and we usually go to the live questions first, and then we'll take the email questions. And if this is of benefit to you, if you find value in this, please like and subscribe and share this with your family and friends. And maybe we can help our dear loved ones and our colleagues and work and friends and family to improve their lifestyles through this good uh, uh, merger of Western medicine and Eastern medicine, lifestyle medicine. So let's start with the live questions. And wouldn't you know it, there's my sister. Hi, Debbie. How are you? Hi to my sister. Back at you, Debbie. And let me go to some questions now. Hey, Debbie, I have a joke for you. Um, where do bad, naughty rainbows go? Nasty behaving, bad rainbows. Where do they go? And the answer is they go to Prism. Prism, get it? Not PRISM. And there, when they're in Prism, they can reflect on their light sentence. You like that? She's laughing. Okay, Debbie, love you. Good to see you. And PJ says, thank you for this great service. Well, praise the Lord. All righty. So it looks like we'll go to more serious questions here on the emails. Barbara starts with, what do you know about GLP-1 in microdoses for treating rheumatoid arthritis? I am not overweight, but I have heard from some respected doctors that research suggests that they may have a direct anti-inflammatory effect independent of weight loss. The whole GLP-1 craze has come on too fast, and I'm unsure of current/future side effects. What do you know about this? Well, I know a good amount. I know that it came out with a black box warning immediately at the onset of making GLP-1 medications available for prescription. It came out with a black box warning of its risk of generating thyroid medullary cancers. So that's never good when you see a prescription drug come out initially with a black box warning. Now, remember, this inhibits your desire to eat. It reduces your appetite. So it's feedback to the brain, and satiation is that you're full. It slows down peristalsis, so it has neurochemical effects. It can cause paralysis. Now, microdosing would be argued would be less of a risk, but again, this is not published or studied. I would far rather and have had rheumatoid arthritis patients who do absolutely fine and get off their methotrexate or their Plaquenil, hydroxychloroquine by using lifestyle changes. And that would be seeing a good functional doctor. This doctor would then get your history and your background and study what likely led to the development of rheumatoid arthritis rather than just shooting out prescription uh, medications at it. And using natural things like even high dose vitamin C, which remember, kappa beta is a inflammatory marker that is upregulated in inflammation. And what's causing the inflammation should be the big question. And the biggest thing that we have found as a general practice is gut dysbiosis, inflammation, leaky gut, materials passing from the uh, microbiome into your bloodstream that alarms your immune system, and molecular mimicry can create this cross reactivity with cartilage and your joints. The same could happen to your thyroid and get thyroid attack, inflammation, thyroiditis instead of rheumatoid itises. And it can molecularly mimic myelin sheath or neurological damage for MS, ALS, various other diseases, skin mimicry for psoriasis. And these are all usually treated by doing a complete digestive stool analysis, looking at your sugar metabolism, insulin, and triglyceride, hemoglobin A1C, and your fasting blood sugar, looking at the time of day that you eat, looking at your stress in your life, looking at your hormone replacement, because hormones, estradiol is a natural anti inflammatory, your hydration status. I mentioned high dose vitamin C, natural anti inflammatories like the curcumin family, turmeric, systemic enzymes that you take on an empty stomach. These enzymes go through your whole body to disinflame the whole body. So we have, over the decades here at this place where I've worked, I have helped many women with rheumatoid arthritis, MS, other arthritises, neurological inflammation improve with these other things. So I wouldn't goof around with prescription medicines like that, especially that they have a black box warning. Uh, and then back to the live questions. My sister asked, "Could you tell me about SBI Protect?" And SBI Protect is serum derived bovine immunoglobulins. Serum derived bovine immunoglobulins. And if you get them from Orthomolecular, a company that has high standards for sourcing their materials, these are from New Zealand, Jersey cows, I believe, and they are not given antibiotics or drugs or steroids. And the colostrum of these cows is full of immunoglobulins, like a mother's breast would have all the antibodies for the newborn baby. These immunoglobulins, especially IgA, are high in the colostrum. And so if you take that as a capsule when you're trying to quiet down an inflamed, upset microbiome in your gut from too much sugar in your diet and fruit sugar feeding the bad bacteria, and too much starch and sugar from the grains and pastas and sodas and candies feeding the bad bacteria. Those then creating a ground to create abnormal microbiome and fungus growth. These then can produce waste products that injure the lining of your gut, creating cracks of leaks, separation of cells that should be tight in junction, then they get open, and then the material in your gut, that bad bacteria can leak through, inflame your body. Lipopolysaccharides, very alarming. And then your whole body has this general inflammatory alarm going on. And then finally, there's molecular mimicry. And then you get diagnosed with the end of the fruit of the tree. It may be in your epigenetic situation to have chronic eczema, or another person's fruit of their tree will be rheumatoid arthritis or some of the arthritides. Another person's end of the fruit of that tree of the same disease problem will be some neurological MS or Lou Gehrig's disease or something like that. So why should we go into waiting for this disease and all these outlier treatments? Why don't we start from the core? It doesn't mean you can't consult your specialist, but you can come alongside, and that's what I've done all these decades. Is come alongside the specialists and work with the patients under the care of a specialist, especially if they have had an MRI proven MS or something like that, rheumatoid arthritis with their rheumatologist. And then we work on their lifestyle and diet and hydration, and then we improve them that way. So, no, for GLP-1 and microdoses, let's make sure that we stay away from medications as a last resort rather than a first resort. And then Deborah also asks, how do kidney stones form? Well, typically calcium oxalates and oxalic acid is produced in many biochemistry pathways. So if you drink a lot of alcohol and eat a lot of fructose, if you look at the YouTube by Dr. Lustig, Lustig, and it's called Sugar, the Bitter Truth. He has this big cell on an image right around the 1 hour part, and you'll see him compare glucose metabolism versus fructose metabolism entering the cell for being processed. When you see how fructose is metabolized, it's almost like a toxin like alcohol associated with a metabolism that produces a lot of oxalic and uric acid. And these are damaging with high triglycerides. So there's really no way to describe fructose high consumption, which is in our high fructose corn syrup. It's in our soda pops. It's in almost all restaurant glazes because it has a higher sweetness taste. So it addicts us, attracts us to reconsuming these terrible foods that are very hard on our liver. Now, with the kidney, if you're eating a lot of these smoothies and shakes, spinach, a lot of people hype the value of spinach, but it's full of oxalic oxalates, high oxalates. And there's a book, I wish I could remember that lady's name. She warned about, the title of the book is Toxic Superfoods, Toxic Superfoods. And it's all about all these wonderful kale and spinach and various vegetables and other items that we eat in our diet that we think are very healthy for us, full of oxalates. And remember, I'm not against eating vegetables, but if you cook them and you kind of cook out some of the anti-nutrient challenges, like the cooked versions tend to be better than the raw versions. These are consumed, and if you are taking, God forbid, you're taking calcium supplementation, we get plenty of calcium from our diets. You don't need to take calcium. That will combine, especially if you're underhydrated, if you're not drinking water. So, the typical person who gets kidney stones is a coffee drinking person who doesn't drink much water at all, and they're chronically dehydrated, and they're taking foods rich in calcium and supplements and multivitamins that have a lot of calcium. And they wind up over the years getting calcium oxalates. So the oxalates in the food and the calcium in the food in a dehydrated situation generates these stones. I That happened to me. I was an ER doctor for many, many years, and there just never was time. We were in a level 2 tertiary uh, ER. We didn't do neurosurgery, but we had a lot of trauma coming in. It was hard. And I never drank enough. Why? Because I didn't want to stop to pee. And so I hurt myself, and I had a kidney stone then. I believe I had two different times kidney stones. And then when I started working here, I often would put off drinking enough water just to try and keep the business working. And I got a kidney stone here. And then I just made it an effort to drink enough water. So really, it's lack of water. Jennifer says, "Hi, Dr. E. I think my skin is sensitive to the estradiol cream I apply to my forehead. Can I apply it somewhere else, like my wrist?" Absolutely. Yeah. No, no doubt. You can put it on the inside of the wrist, wherever the blood vessels are, like that. That'd be just fine as a general guidance. Charlene says, Sally K. Norton is the author of Toxic Superfoods. Thank you, Charlene. Jenna says, I have that book, Toxic Superfoods by Sally Norton. Thankfully, I am not oxalate sensitive. All right, let's go back to our questions here. Linnea says, how would you handle a large lipoma on the clavicle? Right up here, a large lipoma. The MRI shows it's not cancerous, but it's about as big as an egg. At this point, is there any way to avoid surgery? Probably not, Leanna. When we see benign moles, skin tags right at the belt line or at the bra line, where the straps are, or where we're putting our tie and clothes on, these trauma trigger sites very often is just because the irritation of daily clothes and rubbing will create skin irritation. So that is the reason why we remove them. So that's the thing. The What causes a lipoma? There are just people who tend to, in the American dietary world, have so many carbs with so much insulin that their doctors never test their insulin level, and they wind up being a high level insulin, and that can trigger some fat cells to become ballistic, you might say, extremely big, storing triglycerides inside the fat cell. But when they get big like that, they also produce inflammatory uh, cytokines, materials from stress, inflammation. So yeah, I think you're going to have to wind up just having it surgically removed. Let's see. Jean says, okay. Dennis says, is cadmium really a micronutrient? My biochemistry professor showed a list of micronutrients, and cadmium was on the list. Yes, because there are different valences, you might say, just like there are different valences or energy levels reduce or oxidize of iron. The same for cadmium. And so that can, in different charges, be toxic to a human being. Other charges can have possible benefit. Yeah. Let's see. the next question is Krista says, what are your thoughts on Berkey water filters? Are they safe? The answer is yes. I have one sitting right here that I've used for years. Mine is called Alexa Pure. I got it from, uh, what is his name? Alex Jones. That's why it's called Alexa Pure. But it's the Berkey water system that markets it through um, Alex Jones Infowars. And that's where I got mine. Yeah, they're very good. Uh, then she goes on to say, also, what are your thoughts on drinking celery juice every morning? Uh, Also, do you know if the juice plus capsules can be opened up and put into your yogurt or applesauce? Thank you. Yes, the juice plus capsules can be opened up. Drinking celery juice, I'm not really for it. Celery juice is for hydration. It has a lot of water in it, but I'd rather you drink the glass of water. I'd rather uh, you take real water than a celery stick pulverized up in a blender. Um, it does have antioxidants, polyphenols, apigenin, I think, is in it also. These things have antioxidants in them that may be of value, but the and then the fiber that's in them may have value. So I'm not going to say you can't, but usually what people do is they dump many different vegetables into a smoothie, and it becomes at one risk an oxalate excess challenge, because you can get a whole lot more in a dose than you would if you had to eat it with chewing. That slows the amount of exposure you would get from those oxalates. And the sugar availability after blending them pulverizes it, and the starches, cellulose, becomes more available increasingly as sugar. So it's another unnecessary exposure to excess carbohydrates. Margaret says, are there vitamins to take that can help you with depression and anxiety? For sure. I am taking B complex and D and K2 and magnesium. Well, I hope you're taking methylated B complex. Uh, Thiamine is probably the most underrated. Vitamin B1 is probably one of the most underrated B vitamins for neurotransmitter production. Remember, your gut is probably one of the biggest sites where you make serotonin. The other thing would be a low carb diet. Your brain functions better on ketones, uh, medium chain triglycerides, MCT oil is helpful. Exercise is very, very helpful. Doing exercise 3 times a week, both weight resistance and aerobics, would be a natural mood elevator, antidepressant. Um, it would help with anxiety as well. I'm glad you're on vitamin D, but you have to have enough vitamin D. So find a doctor who will measure your D level to make sure it gets up into the 80 to 100 range. Um, the methyl component on the B complex needs to be there. So it has to be methylated B complex. And how much thiamine? Even 200 milligrams, I think, if I recall correctly, are the studies of the amount of B vitamin, 100 to 200 vitamin B1 thiamine, uh, with a hefty dose with the others in a B complex. We've done that with our TLC methyl B complex and uh, the methyl B complex we get from orthomolecular here. And usually it's 1 to 4 capsules of ours or 1 to 2 capsules of orthomolecular. And you could, increase the dose from it. Your urine will look like a chartreuse yellow color. Uh, Magnesium is very good as an antidepressant. A good night's sleep is a very good antidepressant. Standing in your bare feet, getting grounded every morning at sunrise is a mood enhancer. I said the low carb diet, exercise, hydration, drinking enough water is calming for the brain. And then hormone replacement therapy, because most women will start experiencing depression and anxiety as they go through stress and menopause. And so we certainly recommend natural hormone replacement for the men and the women. And yeah, that'd be a good start right there. Mark says, what is a good protocol to turn around Alzheimer's? Mark, Dr. Bredesen, Bredesen, is a neurologist who wrote about 10 years ago his book on this. And I'm glad, he did it. He's a neurologist. That's his specialty. We've been doing it long, long before his book was put together with the natural hormone replacement therapy for adults with Alzheimer's, estradiol for the women, testosterone for the men, exercise, a diet that's low carb. Remember, better cognitive function is in a ketogenic like body. Not eating late at night so you get better sleep. So we usually don't let patients with Alzheimer's eat after 3 or 4 o'clock in the afternoon at all. Adequate hydration along with her exercise. We don't restrict salts. We give them the Celtic salt, salting their food to taste. We put them on an excellent multi-mineral for magnesium and potassium. We put them on powerful polyphenols, which are the antioxidants in the fruits, vegetables, and berries, and I use the Juice Plus for that. We put them on vitamin D and get their fat soluble level of vitamin D up to about 100. And then getting them involved in social activities, working as long as they can work functionally, getting them into ministry service, getting them into helpful, supportive industries like helping childcare, helping at nursing homes, anything that puts them into service and of use. So Dr. Bredesen's book, Hormones, antioxidants, polyphenols, D levels, with exercise and the mean MCT oils would be valuable. Asia says, hi, Dr. E. I've noticed on sunglasses there is a Prop 65 warning. Also, I'm not on the computer much, but for the short time that I am, there is a strain on my eyes and also when looking at my phone. What do you think of blue blocker glasses? I think a lot of them, because the glasses I wear are blue blockers, and I've used these for years. Optic Blue, OPTIQ BLUE is the brand name that I use. I think it's one of the highest regards. My optometrist got them for me. What do you think of the blue blockers? Do you know of a trusted brand to recommend? Yeah, Optic Blue. Yeah. And then Diane says, Dr. E, my postmenopausal sister just tested very high on her oxidized LDL 549. She is lean and healthy. She eats a clean ketogenic diet. Her coronary artery calcium score is 0. Total cholesterol 318. HDL is 78. LDL is 227. Triglycerides are 85. Absolutely fantastic. Any thoughts on what has driven up her oxidized LDL? Bless you. Diane, there are a group of people that have been found to be hyper responders to the lean mass hyper responders to a ketogenic diet. It has not been found to be an increased risk for heart disease. And this is being intensively studied by the carnivore and keto diet promoters on YouTube. You can go, what is a good podcast on that? Can't think of the name of it. There are plenty of podcasts out there on the ketogenic diet and research on the LDL elevated LDL lean mass hyperresponders to the ketogenic diet. So if you type that in on YouTube, you'll see these guys who look at research all the time, and have studies. There's a study coming out, or has come out in the recent year or two, and they're expanding the study, where they looked at these gentlemen from uh, low carb down under. It's called low carb down under. This is an Australian based YouTube group of physicians that originally kind of looked into the lean mass hyper responders, LDL elevated people. And I think the conclusion is it's just a non-issue of risk for heart disease. And certainly when I look at all these numbers, remember when I was on active duty in the 1970s, starting my medical training and practice, all those military men had total cholesterols of 430. I don't recall, they're 360s. Yeah, very common. That was the common range of the cholesterols at that time. So I just applaud her HDL matching her triglycerides. Her HDL is 78 and her triglycerides are 85. So they're basically equal. So her exercise HDL is equal to her consumption of energy from carbs, triglycerides. I don't think I would worry about that. That's my understanding of the LDL hyperresponder lean mass people, and she's probably one of them. But go to low carb down under on YouTube and put lean mass hyperresponder, and you'll see those doctors just pour out a bunch of research that was just done. I just don't have it on the tip of my tongue, but I'm not worried about your sister. But of course, she has to share that with her doctor and make her own decision. Let her watch the YouTube and discuss it with her doctor for oversight, because I don't know if she has any other comorbidities or anything. Let's see, what's the next question? Elizabeth, hi, Dr. Rita. What would cause iron level of 189 and a EOS, absolute level of 0.7 in a male age 41? Don't know the blood type. Works out, takes supplements, but is always tired. Also is a 553 free testosterone level normal for a 41-year-old. Elizabeth, there are so many things that go into this: his diet, his body mass, his sleep, his other inflammatory markers, his ferritin level. So I would have him see his doctor. A total iron of 189 is not terribly high, but that does put it in a mildly elevated range. So likely it's not a concern. He might be taking a multivitamin that has iron in it. He needs to try and get out unnecessary sources of iron. So you would look and make sure he's not on a multivitamin with iron in it. And postmenopausal women who don't menstruate should not have supplemental iron either in their diet. I think his testosterone levels are fine. So have this gentleman seen by his doctor and look at the ferritin and other inflammatory molecules, look at his diet, and evaluate him from that point, get his liver enzymes, and go from there. Mano says, eye health. What about Macumira in Canada? Macumira, Macumira. Macumira is one word, but they capitalize both the M. It's a trade name for a microcurrent device that you put. It's like a holder you put on your head, and it puts a little microcurrent right through here. It's like pulsed electromagnetic therapy, and this microcurrent helps with microcirculation. Anytime you improve the microcirculation, you're going to have better behavior of any tissue. So we have all this macular degeneration improved, not needing their Avastin eyeball injections or greatly reducing their need for them, preserving their ability to drive. On many people who do EDTA chelation therapy, so that it helps the entire body, the entire vasculature of the entire human being. You have to remember, you have hundreds of thousands of tiny capillaries. Let's say that's 99% of your tissue delivery of nutrients and removal of waste. And you have 1% of all your blood flow in bigger vessels. So people who do EDTA chelation have the benefits of EDTA improving nitric oxide delivery, improving the blood flow, reducing damage from oxidative stress. So Macumira in Canada, it's just another method of delivering microcurrent therapy. Exercise would do this. Extra vitamin C would help. Extra magnesium would help. A very low carb diet would help. Not eating after 3 or 4 o'clock in the afternoon would help. Drinking enough water, half your weight in pounds as ounces every day would help. All these things would be of benefit. Let's see, we have some new questions here. SBM Jen says, how many nicotine lozenges a day would you recommend for an adult? The anecdotal research is 6 milligrams a day. I get mine at Walgreens. It's in the quitting smoking. I don't smoke cigarettes, but this is like getting the patch to get nicotine patches to help you stop smoking, or you have these lozenges, and the lozenges look like they're very tiny. See how tiny that is? And I just put it up under my lip, like tobacco chewing tobacco, and it just dissolves there slowly. And I do 6 milligrams a day. That's like 1.5 of those lozenges, because they're 4 milligrams each. And then is it based on age, weight, sex, or blood type? Not really, no. I wouldn't give this to children, but there's nicotine in tomatoes and tomato sauce and eggplant and potatoes. So they're getting nicotine. You're getting nicotine also in your diet. So it's not a carcinogen. Then the next question, Alexander says, my carotid artery shows mild stenosis after ultrasound. My cholesterol and triglyceride numbers are good. Well, what is good to you may not be what we would call good. Low blood pressure. Doctor said I have genetic markers checked. Lipoprotein little a. Well, why don't you take high dose vitamin C if you have lipoprotein little a, because that's what I have, and I take extra vitamin C to help mitigate that risk, the risk of that for cardiovascular disease. Really, there's not much at all known to lower lipoprotein little a. But of late, it looks like high dose vitamin C seems to be very, very valuable in that. Now, we consider triglycerides to be healthy if they're roughly 75 or less, and they are basically equal or very close to HDL from exercise. We don't care really what your total cholesterol or your LDL cholesterol is. We care more about your fasting insulin, your fasting blood sugar, and your hemoglobin A1C, whether or not you drink enough water and exercise. And that would be our approach to this. I'm glad your coronary artery, you didn't get a coronary artery scan. You just had the ultrasound. Okay. So why don't you ask them to do a coronary artery scan as well, Alexander, with your doctor? That'd probably be the next step. But long and short of it is, it looks pretty good for you. Nida says, what options are there for stones on the kidney? Not much. You better drink a lot of water and just resolve yourself to drink a lot of water, and don't eat oxalate rich uh, spinach and kale and foods like that. You can Google what are oxalate rich foods. Make sure you're well hydrated, and then you can take systemic enzymes to reduce inflammation in your diet and eat a low carb diet. That's the best thing you can do. And then work with your doctor, your urologist. Sometimes, if you have a lot of stones or recurrent stones, lithotripsy is the ultrasound targeted pulsing to break them up so that they'll be removed. How much of a dose of vitamin C? Well, what I do is I probably take 6 grams minimum a day. Now, for you, that might make you have diarrhea, but I've been doing this so many years, my gut is tolerant of high dose oral vitamin C. What's that guy's name? I can't think of it. Maybe next week, if you're on the channel, I'll come up with the gentleman's name. He is a PhD in chemistry, and then there's a MD, PhD out of Harvard that does a good job on talking about the research on lipoprotein little a, and its stickiness is inhibited and reduced even 25% with vitamin C. Somewhere in the range of 6 grams a day, I believe, is what's sticking in my mind. But I'll remember that. I'm going to write myself a little note here to get the name of the MD PhD on lipoprotein little a and vitamin C dose. Okay. All right, Alexander. We'll see you next week. So I can, let me put this right there so I can remember it. There you go. So I have that all set up for you next week. Okay. Let's go back to these questions. And it says, Alexis says, my father-in-law has prostate cancer and has metastasized to the bones. Oh, I'm sorry. And his treatment makes him extremely exhausted. Is there anything you can recommend to increase energy levels? How do you feel about creatine? Thank you. There's a lot that can be done, and I have been blessed to work with oncologists. I'm not an oncologist, but I work alongside them with the patient to address their diet of the patient, to maintain their lean mass, and help them with their tolerating the radiation or surgery or chemotherapy that the oncologist is giving. One is high dose vitamin C therapy is tremendously beneficial. Getting the vitamin D levels up, getting methylated B complex up for their metabolism, and looking at the hydration status. And they have to start some form of exercise, even if it's from the chair, as well as bands for stretching to help get muscle tone. Now, there is a lot of anecdotal that needs to be evaluated with clinical trials about the fenbendazole and the ivermectin used alongside of these other standard therapies. And I have patients who I have not prescribed the fenbendazole or ivermectin, but they have found it over the counter or ordered it online, and they are taking with their prostate cancer fenbendazole. I have some patients taking 222 to 444 milligrams a day by oral route, and doing that for 3 days on, 4 days off. They also take 12 to 24 milligrams of ivermectin 3 days on and 4 days off. And there's need for the oncologist to get a hold of this, because I'm not telling the patient what to do. I'm observing what they're taking, just like there are other nutrients and herbs that they might be taking as well. But I'll tell you, one just last week saw me, and he had such bad metastatic disease that it was not looking good for his future. But he went on the fenbendazole and ivermectin about 8 months ago. Actually, I think I mentioned this case before, and he actually took too much, I think, or too many consecutive days in a row, because there needs to be a break, because there can be some bone marrow, blood production suppression, and liver injury. And he wound up getting very anemic and needing a transfusion. So we talked to him about it. I was familiar with all the anecdotal comments and the blogs of people trying this on their own, and then we got the transfusion. His oncologist was aware. Then he went back on a cycling dose, and then he absolutely improved, regained his muscle mass, his own blood production, and did very, very well. So I have to mention anecdotally, these things seem to be doing. I have several several patients doing this, and I'm encouraging their oncologists to follow them and be aware of what their patients are doing and track it. So I track it with them for my patients' benefit, checking their CBCs and chemistries. So he might look into that, but find a good functional doctor that can work with your oncologist and stay open about what they're doing and share everything with them. Kathy says, hormones. I listened to you talk about being on hormones and in many of your patients. With an estrogen positive, progesterone negative, and other mutations found genetically, I find it hard to fathom going off letrozole. Letrozole is a prescription drug given to block estrogen in women that have estrogen positive receptor cancers on the pathology. They're usually on that for 5 years or more. My cancer treatments were done in 2022. I listened to the estrogen benefits, but in current oncology offices like mine, AI meds are the norm. What is the name of that? This is an expert panel discusses hormone replacement therapy, and that was the FDA. So if you do a Google for the FDA expert panel on hormone replacement therapy, you're going to see how far Western medicine, standard medicine, has come in the past 20 years with these doctors opening up to the usage of estradiol for quality of life and care of the whole person. So, FDA expert panel on hormone replacement therapy is a 2-hour long listening in on the FDA out in Washington, D.C. that took place about a month ago. It's worth your time listening to, and read the book Estrogen Matters, and also get the article on it says hormone replacement therapy after breast cancer, it is time, by a Dr. Blooming, Bluming, and this was published in May of 2022 in The Cancer Journal, volume 28, number 3, May, June for 2022. And the title is Hormone Replacement Therapy After Breast Cancer, It Is Time, by Dr. Blooming. His first name is Avrum, Avrum, Blooming, Bluming, MD. So that might be beneficial to review it like that. What's next? Leah says, good evening, Dr. Rita. I am wondering if while you do a fast, if you take all of your supplements. The answer is yes, except for digestive enzyme. And yeah, I came off of my 4-day fast. Labor Day was Monday last week. So I didn't eat from Monday lunch all the way till Thursday at 3 p.m. Okay, so yeah, and I take all my vitamins and I work, and I went and did my workout and everything, and I'm going to be 72. So I just want you to understand you can do this. But I didn't take digestive enzyme because I didn't eat any food. So that's the only one I don't take. Um, let's see. And then also, is it okay to take medium chain triglyceride oil while fasting? Technically, that's breaking your fast, but a lot of people will put a tablespoon of butter in their warm tea or warm coffee and use that, or they'll put it in a hot cup of chicken broth or beef broth to prolong their ketogenic time. Yeah, and when I was urinating on my ketone strips, they were dark maroon red. So I was really pouring out a lot of ketones and getting some oil in there really never seems to change it for me, but it could for someone maybe a little more sensitive, but I think that's fine. And when are the best times to take medium chain oil? Thank you. I don't think there is a established good time. I think when you're thinking about food or too much, or you're trying to break through and get into your second day of fasting or your first day, the medium chain triglyceride will help satiate you so you learn the discipline of it. So I think there's any time you want to. And then Dawn says, my daughter was asked to do a TB test for her work. She works for a company that tutors high school students on campus. Do you have any word of advice or concern about the TB test as it's administered and how records are stored? No, not at all. What they do is they just put a little prong, they gently press it into your skin here, and 2 days later, they look to see if your body makes a inflammatory reaction at that little site in the dermis. That's totally safe to do. Art says, does regular air travel for work deplete good health? Yes, it can. Any risk or advice if I fly out in the morning and then fly back the same day in the evening, one time each month? If all you're doing is one time a month, that's like a chest X-ray. Each time you fly, roughly a 3 hour stint, like East Coast to West Coast. When I was a flight surgeon, one of the things we were looking at was this free radical damage in the 1980s and the increased prevalence of neurological disease in pilots. And when you're flying, 30, 40,000 feet from the uh, Earth's surface, the radiation, gamma radiation, is going through you like a chest X-ray, and so it's likely going to damage or potentially hurt some DNA. But really, if they took Juice Plus, if they drank enough water, if they were fasted during the flight, I think fasting during flights is the best thing to do. Um, and if you take vitamin D and you take Juice Plus and a multi mineral that is amino acid chelated, like magnesium, potassium, with methylated B vitamins that help stabilize the DNA membrane, uh, and exercise and get a good night's sleep. Hopefully, you won't get much jet lag. You might need some melatonin to help you on the night you go to sleep. But if you're going back in the same day, you're going to wind up within probably the same time zone. So the melatonin may not be needed. Exercise is very important for recovery from that. But just realize every flight is a chest X-ray. Essentially, that's what we're exposing ourselves to. But take those things, and you should be doing very well. Let's see. I have one from uh, Jackie. Jackie says, I have a test urine for heavy metals. Would that reflect my exposure to contrast dye from previous scans? Yes, it definitely will. Definitely it will. And yes, we're seeing all these scans being used so cavalierly. I don't think doctors understand the retention of gadolinium and its neurochemical damage that it does, and you can get toxic from it. Christina says, hi, Dr. Rita. What does it mean if your body is a little on the acidic side of a test strip? It's from a strip that you get put on your tongue. Probably, it depends on your whole who you are. I mean, your weight, your age, did you exercise that day? Did you eat a high carb diet that day? Are you fasting? Did you drink enough water? What was your sleep like the day before? So there's so many other factors, Christina, that we would have to know. It really is of itself meaningless. So I don't get into this acidity, alkalinity testing of the human body because it's all over the place in podcasts and discussion. Your doctor should be counseling you all the time to drink enough water every day, to get to bed early and arise early. Stand up and get your little toes in the wet grass in the morning and get grounded for 2 minutes in the early sunrise. Exercise, eat a low carb diet. If you're over 60 years old, try and not eat past 3 o'clock in the afternoon. Find out your blood type. I recommend, iodine, Juice Plus, multi minerals, methylated B complex, and vitamin D with K2 as my core basic nutrients, and so forth. So there's so many things that go into it. Amela says, "Hi, Dr. E. What causes a soft palate swelling in teenagers?" Soft palate swelling. Well, there could be an infection in the sinus above it that'll make the roof of the mouth on that side of the palate and sinus pressurized down. There could be a tumor growth. There could be a benign fatty tumor, lipoma. Um, there could be a tooth infection as well. So there's several things that can do that. Um, Brian says, "Dear Dr. E, please comment on the use of nifedipine Procardia, which is a calcium channel blocker, to address poor circulation in the hands, and that's often called Raynaud's syndrome. Cold, numb, discolored fingers during the colder months has been an issue for 6 years. I'm 65 in good health and follow your lifestyle advice. The work ordered by the rheumatologist did not offer any clues. Scheduled to start drugs soon." Well, I would do EDTA chelation. Remember, vitamin C is a natural calcium channel blocker. Magnesium is a natural calcium channel blocker. Uh, Quercetin in our seasonal shield is a natural calcium channel blocker. A low carb diet, a ketone rich diet is a natural calcium blocker. The EDTA chelation helps release nitric oxide to allow for vasodilation. Um, Systemic enzymes are a powerful anti-natural platelet inhibitor. Uh, Adequate hydration, those kind of things is what I would say. So I'm not against drugs, but if you're not doing these other things, I don't know who your doctor is, but if you were to see your doctor or see me, I would want to know what your blood type is. Are you using digestive enzymes? What is your insulin level? And then what they say on the ranges that you're normal is way too tolerant. My insulin is 4 or less. My triglycerides are 50, roughly 75, if I'm being generous. My hemoglobin A1C is 5.2 or less, and my fasting blood sugar is 85 or less. Your C-reactive protein needs to be done. Your sed rate needs to be done. Your food allergies need to be done. A complete digestive stool analysis needs to be done. Yasmin says, "Hi, Dr. E, what are your thoughts on mammograms? I'm 47 and have had 2, but I just wonder about squeezing everything in there and zapping it with radiation as well. It seems a bit counterintuitive, yet that's been the medical recommendation. So I would love to hear your thoughts on it." Yeah, trauma, breast trauma, and radiation are 2 known causes of cancer. And a mammogram is a traumatic and radiation to the breast. And you have to understand breasts are made of glands. Glands are fibrous and they are less meaningful in mammography. The older a woman gets, And if she doesn't use natural hormone therapies, then the glands tend to diminish and fat replaces them. And they become potentially more readable. But there's false positive, false negatives. There's overreading, anxiety, cortisol stress impact from mammographic and too many unnecessary ones done. There's still argument over the actual implication of whether mammography has reduced the death rate due to breast cancer. It's an ongoing debate. So I understand your concerns. So you have to ask your doctor what their uh, advice is. Take responsibility for yourself. Do your own breast exam every month. Get familiar with your breasts and ask for an ultrasound, which is not known to have any of these risk factors with it. But eat a low carb diet, exercise, take vitamin D, and use a powerful antioxidant polyphenol like Juice Plus, quercetin. All these things are known to be supportive of preventing breast cancer. So your lifestyle is far more important than showing up for a mammogram. But that's the standard of care is an annual mammogram. And so that's what we're told to tell you. But we can't force you to do it. But don't neglect your personal self-care and exam every month. Anne Marie says, my 19-year-old athletic son has been diagnosed after a CT scan with contrast with a mass on the back of the mouth and soft tissue palate. The doctor speculates that it is heterogeneous soft tissue, possibly fatty components, maybe a lipoma. The doctor is asking for the MRI scan with and without contrast. I don't want the contrast. What are your thoughts? I think it's too important to find out what this is, so I would do and follow what your doctor is advising. And if you can get EDTA chelation after these scans, we can pull the gadolinium dye out through EDTA chelation. It'll pull out the gadolinium, and he can do a few of those. But follow their advice and get that worked up appropriately for your 19-year-old son. Paul says, who in our area, Orange County, would you recommend for general back of throat surgery? Thank you, Paul. You know, most of the guys my age are retiring, are already passed away, or they are out of the state of California due to the politics. So I don't know of one. I'm so sorry, but if you call the front office, I'm thinking of one, and if I can recall his name, I just can't think of it right now. So Paul, call the office, and we'll see if we can't find a ear, nose, and throat doctor name of someone I think took the place of someone who I think is good. All right, so let's see. Did we get everything else? Sharon, I'm a type 2 and started not eating after 6 until 10 a.m. Do you think that's okay? I think that's wonderful that you're doing it. If it's possible to try and back up your eating evening meal to 4 p.m. And eat between 10 a.m. to 4 p.m., that would be far better. But that's a wonderful, good start. You're on the metformin, and looks like you're doing. But Sharon, you got to do weightlifting. You have to do it 3 times a week in the gym if you have no other contravening problems. So I think with that, we've gone over already. Ladies and gentlemen, if this is of value, please don't forget to hit the like button and help this be shared. And we'll see you next week at 6 o'clock. And I will look up that name of the MD, PhD guys on lipoprotein little a vitamin C dose for Alexander here. And we'll see you next week. May God bless, be loving and kind to everyone, forgiving, grace. I've received grace. I want to give out the grace of God. Take care. Good night.